is Jason Diamond, and I'm a facial plastic surgeon. I trained in head and neck and facial plastic surgery for 5 years, and then I came to Los Angeles, where I spent about 2 years studying with the most famous plastic surgeons, facial plastic surgeons and dermatologists in the world, and really learned all the tricks from those individual people who became famous for whatever it is they're doing. I learned those techniques from those people and was really able to combine the best of the best to put together the most state-of-the-art plastic surgery techniques available.
People who see me that don't know that I've had surgery think that I just look great. Strangers will come up and tell me how good I look.
They say things like, did you do something to your hair? I don't think there's anything they can actually put their finger on, but they see improvement.
And the people that did know me before look at me and they say, well, something changed, but I'm not quite sure what.
My initial reasons for wanting surgery was that I could see changes in my face that I didn't like and felt that surgery would really eliminate.
Hello. So how are you this morning?
I'm fine. I'm all psyched up.
You're psyched up?
Yes.
Yeah, me too. I'm excited. I'm excited for you.
Are you?
This is going to be great. What we're going to do, we were talking about raising your eyebrows and giving you a nice little lift to the eyebrows, particularly more on the side than anything else, to help improve the heaviness of the outer eyebrow. Okay? The other thing that we're going to do is the cheek lift is going to restore your cheek. We're just going to pick that up a little bit, which will help the cheek appearance and will help the lower eyelid. It will help smooth out the whole appearance of the lower eyelid and cheek complex, okay? It'll also help improve these lines here to restore that feminine, youthful cheek appearance. And we'll do that all through the same small incisions that are hidden inside your hairline. And that'll be great. That will help rejuvenate your lower eyelid as well as the cheeks. And that's a very important part of the face to be rejuvenated, and that will look amazing. Okay?
Yeah, just the slightest millimeter makes the difference. Well, I have all the confidence in the world in you, and I truly mean that, and I'm looking forward to it.
The first time I went into Dr. Diamond's LA office, he was extremely cordial and spent time getting to know me.
My experience in the office in the LA location for the first time was wonderful. Dr. Diamond is extremely confident, and I like that.
Hey, I'm going to have you stand up against this wall so we can take some pictures.
Okay.
Okay.
Well, I just, I don't like all this stuff down here, and I think maybe that's the first reason. It just started to happen in the last few years. So that was my main reason, but while I'm here, I'll have other work done too, and a bit of a brow lift, and I like what he said about the cheeks. I didn't know it would be doing anything with that. So I think I just want to look like myself, only more enhanced, more youthful than I was starting to become. And it was only going to get worse. So this will give me maybe a 15-year head start on things, right?
Following your initial consultation, I meet with my anesthesiologist and my scrub assistant and my nurse days beforehand to put together a precisely tailored plan to meet your particular surgical circumstances so that we can deliver a result that is exactly what you want. First marks I'm going to make are the ones for the brow lift, okay? We make our mark, it's a tiny little mark, as you can see. No one is ever, her hairdresser won't even see this. That's good. We'll do the same thing on the other side. Small incision well into the hairline, which will never be seen, and again, that will allow us to get a pull like that. So the overall effect should be something of this nature. Something very subtle, but just enough to clean up this heaviness here.
Each person that I dealt with at the office in Los Angeles was concerned about me and very personal, and spent the time that I was hoping someone would spend to assure me that I was doing the right thing.
Okay, I'm going to have you seat here. Your head goes here, and this will go under your knees to make you comfortable.
So everything went great. We just finished. It was a long day. I'm very happy with how everything went. I couldn't have gone better. She'll have a pretty good course for the next week. She'll be pretty swollen, pretty beat up, but by about 7 to 10 days, she should be looking great. And by 2 weeks, she'll look like she hasn't looked in 20 years.
I would recommend Dr. Diamond because of his knowledge, his confidence again. It's wonderful. He's good with patients. I would just highly recommend Dr. Diamond.
I've actually sent people to him, and they're so impressed, and they want to have him do their surgery. He's the person I trust.
Number one, my results turned out great. Number two, he is compassionate, caring, extremely involved in what he's doing with each and every one of his patients. Number three, he is so technologically advanced past whatever these old guys can do. I mean, he is absolutely cutting edge. He's got every new technique, and he has the confidence that he is going to do a good job. And that, to me, makes for the perfect combination.